Okay, so someone asked us to talk about the Balint Syndrome, and it's characterized by posterior parietal lesions, and the patients have a triad, and from an ophthalmic standpoint, we got simultagnosia, and that's kind of like you can see the trees, but you can't see the forest. You can't appreciate the whole picture. And we have standardized drawings for this, like the cookie theft picture, where there's a picture of a lady washing dishes and a kid reaching for cookies, and he's falling off a stool. They can see the individual pieces, but they can't tell what it is. And in the clinic, the thing we use for the simultagnosia is the Ishihara color plates, because the Ishihara color plates are made up of little dots. And even though they can see the colors, they can't tell that there's a 21 in there. They can just see that there's a bunch of different red and green dots in there. So they can see the individual circles, but they can't see that it's making up a number. Just like if you have a 4 made of 4s, yeah, they might be able to tell that there's a 4, but they can't see this 4 because they can't see the whole 4s. And they might have optic ataxia. So that's a mislocalization in space. So if we hold something up, they won't be able to grab it, or they'll miss. But if they're trying to direct something to themselves, they can localize. So it's not an ataxia from cerebellum, which would be bad going out and bad coming back. It's just bad going to your environment. Going to yourself, you're fine. So this is an optic ataxia. And an oculomotor apraxia. That's a difficulty with getting the eyes to pursue a target or go to a target. So it's an oculomotor apraxia. They can't get started. So these are all parietal types of symptoms because these are deficits in the wear pathway in the dorsal stream. So we got the occipital cortex can see. It's not a seeing problem, but they can't get things going through the parietal lobe. And so when you have bilateral parietal lobe lesions, you might get the full Balint syndrome. Simultagnosia, you can see the trees but not the forest. Optic ataxia, you can localize yourself, but you can't localize things in space. And oculomotor apraxia, a difficulty with the initiation and getting the eyes to move into the peripheral field at will.